Yeah, this is Dr. Caudill Miller, the brain doctor with Dr. Miller's Guide to Neurology. We're going to talk about sort of a rare problem called posterior interosseous syndrome. This is a finger drop. So your fingers lose extension. Your wrist is great, real strong, but a finger drop. We don't see this very often. It's sort of been a weird month. I've seen about 3 of these, and this may be all I'll see the whole rest of the year. So what causes a finger drop? It's damage to the posterior interosseous nerve right here in the mid-forearm. You can see it with trauma. Most of the time we see it, it's just overuse, people that use their hand. But trauma would be the second most common. You see it, they say, with a brachial plexopathy. I've never seen it with what I thought was a brachial plexopathy. You can see it with an infiltrative lesion. We'll see, sarcomas, in the forearm. And you see it with diabetes and rheumatoid arthritis. So if I see someone with a finger drop, we try to treat them, at least 3 months with anti-inflammatories. Sometimes we'll splint the fingers, use some physical therapy, limit, the flexion extension of this arm, and activity modification where they don't use that hand as much. But don't do it longer than 3 months. If they're not better after 3 months, they need surgery. And as a neurologist, we just tell them that there's an arcade of Frost, and they decompress the nerve of the arcade of Frost. They do a little more than that. They sort of remove the fibrous bands around the radiopatellar joint. There's a little fibrous ridge, the extensor carpi brevis, and they ligate the lease of Henry and the distal edge of the supinator. It's a very complicated minor surgery. So don't let anybody do this that doesn't do it. And you're going to have to find somebody in a big city who is very knowledgeable and has done this. So if you have trouble finding somebody, reach out to me, and I'll tell you people in my part of the country that are very competent at doing this surgery. So that's the posterior interosseous syndrome, what we call the finger drop. So like, subscribe, make comments. More later.